Hello, I'm Judah Eastwell, and for those of you who don't know me, I'm the clinical lead GP here at Healthy Prestatyn. It's that time of year when we're starting to see a lot of people with coughs, colds, flus and other lurgies that you tend to get at this time of year as we enter into the winter. By some strange coincidence, this week is also World Antimicrobial Awareness Week, and that's something which is reflecting the level of concern in the medical community worldwide at rising levels of bugs that can't be treated with the antibiotics that used to work well because bacteria have become resistant to them. Now, in real life, that's meaning that a lot more people are dying when previously they could have been treated, and a lot more people are needing to be admitted to hospital for intravenous treatment, where previously they could have had a course of tablets for an infection that is causing problems. Now, there's a drive to try to reduce the amount of unnecessary and inappropriate antibiotic use, but what I'm saying is that doesn't mean we don't want you to contact us if there's a problem, but it needs to be the right people who are contacting us. If you have an underlying health condition that puts you more at risk and it dampens your immune system, so for example things like diabetes, asthma, COPD, which is smoking related lung disease, rheumatoid arthritis or other significant health problems, if you become poorly, we want you to contact us sooner rather than later, and not to leave it as people sometimes will do to see if it gets better. You're the sorts of people that need to be contacting 111 or your GP to have those symptoms assessed and to see if everything is okay or whether treatment is needed. If, however, you generally are very healthy without any significant medical problems, without taking any regular medications, and you get a cough or a cold or a flu, then it's pretty certain that's exactly what you got. A viral infection that will get better by itself, may take 5 to 7 or even longer days, but antibiotics won't help for it. Antibiotics do not work for viral infections. They make no difference whatsoever. Of course, if you develop a much more serious infection, so if you're normally healthy but you're starting to get severe breathlessness, severe fevers and high temperatures, if you're starting to feel shivery or shaky or sweaty, if you're getting any blood up in your phlegm when you're coughing, then those are more serious symptoms, and yes, they would warrant contact with either your GP surgery, ourselves, or the out of hours via 111. Now, some people will say, well, every year I have the same thing and it always takes a course of antibiotics to shift it. Or they might say, well, last time this happened and I felt exactly the same. Well, the doctor or nurse gave me a course of antibiotics and within a couple of days I felt loads better. Well, for that, I'd like to have a look at this graph. And this just gives you an idea of the severity of your symptoms on one side and then the time it takes in days on this side. Now, the point where people contact us or contact health professionals generally is about here. So it's after the symptoms have peaked at their worst or at the peak of the symptoms. And again, if you look at the graph, you can imagine, or you can see, that they're going to get better, whatever you do. And so those people who feel, well, last time the antibiotics helped, probably wasn't the antibiotics if it was something like a viral infection, and you would have got better anyway. Granted, if you had something that did seem on assessment to be a bacterial infection, then fine. Those antibiotics probably were appropriate. But for those people who, as I said, are generally fit and healthy with fairly mild symptoms, whether that's yourself or your child, you're able to get on, able to eat and drink, things improve when you have some simple medications like paracetamol, ibuprofen, then that almost certainly means you don't need to see a doctor or nurse and you can look after yourself at home. Sometimes it's a case of contacting your pharmacy for advice or going online to the NHS 111 website or on our practice website, indeed, for medical advice.